How to heal a meniscus tear. The knee is protected by a C-shaped cartilaginous disc, the meniscus. It cushions the outer and inner edges of the knee, balancing weight across the knee. An injury or torn in the meniscus can hamper normal performance of the knee and can cause pain, swelling and stiffness. If left untreated, a torn meniscus can lead to knee instability, an inability to move your knee normally, and persistent knee pain. To heal a meniscus tear through medication, self-care, exercise, or a combination of the three, start with step 1 below. Part 1. Using self-care. 1. Use price therapy. You can quicken your healing process by using price therapy, protection, rest, immobilize, compression, and elevation. The P, protection, means it is necessary to avoid further damage to the affected area that can lead to more serious complications. The following measures must be avoided. Heat. Exposure to heat causes dilation of blood vessels that can generate more episodes of bleeding. Thus hot baths, saunas, heat packs, or even contact with hot environments must be avoided. Further movement. Limitations of certain activities must be considered to avoid further injury to the involved area. Massage. Any pressure placed on the affected area may lead to more damage. 2. Rest. Avoidance of activities is usually recommended during the first 24 to 72 hours of injury. Adequate breaks or rest should be promoted to ensure proper healing and prevent further damage to the surrounding muscles and tissues of the affected area. Some exercises may be helpful after the initial 72 hours have passed. Those will be discussed below. Ideally, they would be conducted under the supervision of a physical therapist. Apart from these, it's best to stay off it. 3. Immobilize your knee. Splint and bandages may be placed on the involved area to stabilize it and prevent unnecessary movements that can further damage the tissues and muscles. Talk to your doctor about what methods of immobilization are best for your case. 4. Use compression. During the first 24 to 72 hours after the injury, ice wrapped in a moist towel should be placed over the injured area for 15 to 20 minutes at a time with 2 to 3 hour intervals in between. Follow these guidelines to be sure that you don't cause tissue damage, a result of freezing skin. Exposure to cold temperature causes the blood vessels to narrow, thus decreasing flow of blood and swelling in the affected area. Compression also aids in stimulating the flow of lymph fluid, which carries important nutrients to the damaged tissues surrounding the injury. Lymph fluid also removes waste from cells and body tissues, which is an important function during the tissue regeneration process. 5. Elevate your knee. Continuous elevation of the injured area must be given much importance to ensure proper blood circulation and healing of the involved area. Keeping it elevated will reduce blood flow, thus reducing swelling. When sitting or lying down, prop your knee up with a few pillows. It's best to lay down, but you may also sit, so long as your pelvis is beneath your knee. Part 2. Using medical treatment. 1. Take pain medications. Over-the-counter drugs that are used to relieve pain can be incredibly helpful. However, before you start on medication, know that it's best to discuss treatment with your doctor. He or she will likely know which route is best for you or be able to prescribe you a stronger medication. If pain gets severe and swelling is present, consider taking Celebrex, 400 mg on the first dose and 200 mg twice daily as needed for subsequent doses. If you're lucky enough to be without swelling and only experiencing mild pain, try 650 to 1000 mg of Tylenol every 4 to 6 hours as needed. If you drink alcohol, take precaution. Certain medications react negatively with alcohol. Consult your doctor for advice if this applies to you. 2. Take NSAIDs. These are oral non-steroidal anti-inflammatory drugs, NSAIDs. However, they should not be taken during the first 48 hours of injury because they reduce inflammation, which is considered one of the body's compensatory mechanisms. In other words, intake of this drug during this period may interrupt healing. Examples are ibuprofen, aspirin, and naproxen. All of these work by blocking certain body chemicals that ground the progress of inflammation in the involved area. 3. Try physical therapy.